Hello friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today let's move on to the 50,000 series. It includes urinary system, male and female genital system. Let's have a look into it. First, let's look into the guidelines of urinary system. The urinary system code range is from 50010 to 53899. Few medical terminologies. Removal of calculus is called as pylolithotomy or pelviolithotomy. Both are same. Pylolithotomy or pelviolithotomy. It means removal of kidney stones, removal of calculus. Another important one, lithotripsy. What is lithotripsy? It's a procedure. It's also a procedure of breaking up a kidney stone or calculus by directing shock waves through a liquid surrounding the patient. By using a shock waves. Breaking up of kidney stone procedure, that is called lithotripsy. Next one, ureteroneocystostomy. Short form is UNC, ureteroneocystostomy. Means reimplantation of the ureter into the bladder. Cystometrogram, CMG. Cystometrogram. It's a test to measure how much urine the bladder can hold. Now, few guidelines. Renal transplantation, as we have already learned before about the transplantation procedure, like it involves three main steps, right? Living or cadaver, donor, backbench work, and recipient allotransplantation. So similar to that. So we have learned before about liver transplantation and similar to that pancreas transplantation. Here it's renal transplantation. So it involves the same three procedures: living or cadaver, donor, nephrectomy, which includes harvesting and cold preservation of graft, backbench work, dissection and removal of perinephric fat, preparation of ureter, renal vein, etc. And then finally, recipient renal allotransplantation, which includes transplantation of the allograft and care of the recipient. So whatever transplantation procedure is there, these three procedures should be there. Coding should be there. Okay. Now another guideline. Codes 50430 and 50431 are diagnostic procedure codes that include injection of contrast material. If any question comes and the answer belongs to these two codes, 50430 and 50431, these are diagnostic procedure codes, but it includes contrast material injection as well. No need to code separately for the injection procedure. Now, codes 50432 to 50435 represent therapeutic procedures describing catheter placement or exchange. So these are the code ranges for the catheter placement. Now, CPT 52005. What is CPT 52005? It means insertion and removal of a temporary urethral catheter. During diagnostic or therapeutic cystourethropy is included in the code range 52320 to 52356 and should not be reported separately. So it means if there is any, you have come across any procedure code with the code range from 52320 to 52356, and the question includes about a catheter placement, temporary ureteral catheter placement, it means we don't have to code the catheter code CPT 52005 separately. No need to code it separately. It's already included in that code range. You will be learning more when we will do the practice questions. Okay. For reporting a cystourethroskopic removal of an indwelling urethral stent, use code 52310, 52315 and append modifier 58 if appropriate. Removal of an indwelling stent, we need to use these two codes along with modifier 58 if appropriate. What is modifier 58? Modifier 58 means the procedure done during the post-operative period by the same physician. So If it is appropriate, we need to append the modifier 58 also. Next one, do not report 52000. That is cystourethropy. The code for cystourethropy is 52000. Do not report along with, in conjunction with 523202, 52343 and 52356. Do not report 52351, that is cystourethropy with ureteroscopy and piloscopy in conjunction with, the code range is given 52344 to 52346, 52352 to 52356. While coding procedures, you will be getting all these coding tips from the CPT book as well. Okay, so I'm just putting it here, marking it here in order to make you understand. But while coding each and every code, it is already mentioned there. Cystourethropy, we don't have to report it separately, as it is already included in the other procedure in this given code ranges. Now, for bilateral insertion of indwelling urethral stent, use code 52332 with modifier 58. So that's all about urinary system guidelines. Let's move on to male genital system guidelines. The code range is from 54000 to 55980. In male genital system, the main important guideline to be remembered is circumcision codes. Okay, there are three circumcision codes: 54150, 54160 and 54161. 54150 represents circumcision using clamp or other device with regional dorsal penile or ring block. There is no age mentioned here in this code. But for 54160, circumcision other than clamp, neonatal, up to 28 days of age, 28 days or less. 54161, circumcision other than clamp for older than 28 days of age. So using a clamp, we'll use the code 54150, and without using the clamp, we'll use the code 54160 for age up to 28 days, neonatal, and above 28 days, we'll use the code 54161. Now, for reporting diagnostic and surgical procedure, we need to code only surgical procedure. And for reporting normal and laparoscopic procedure, we should code only the laparoscopic procedure. Now, few medical terminologies. What is orchiopexy? Orchiopexy means a surgical procedure used to treat an undescended testicle. What's Mullerian duct cyst? Mullerian duct cyst is an uncommon congenital anomaly in males that's arising from scrotum to prostatic utricle. Don't be confused with Mullerian duct and Mullerian duct cyst, because Mullerian duct is the medical term which is used in female genital system, but here this is a cyst, Mullerian duct cyst, that is commonly in males. Now, for any excision procedure along with hernia repair, we need to use the hernia repair codes from 40,000 series. As I have discussed when we learned 40,000 series, the last section, it was discussed about hernia repair codes, right? So for any excision procedure codes for male genital system, you need to use those hernia repair codes from 40,000 series as well, along with the excision code. You need to code it separately. Okay. Now another two codes, 55970 and 55980. These two codes represent the intersex surgery, where 55970 represents male to female surgery and 55980 represents female to male surgery. So these are only the few important guidelines from male genital system. Now moving on to female genital system guidelines. The code range is from 564052 to 59899. Comparing to the genital system, female genital system is more important. You will definitely get at least one question from this session. First, let's see some medical terminologies. What is vulvectomy? Vulvectomy means surgery to remove vulva. It's of 4 different types: simple, radical, partial, and complete. Simple means removal of skin and superficial subcutaneous tissues. Radical, removal of skin and deep subcutaneous tissue. Partial means removal of less than 80% of vulvar area. And complete means removal of greater than 80% of vulvar area. Now, another two important medical terminologies. What is colporrhaphy and colpopexy? Colporrhaphy means all the sutures placed in the vagina to repair the weakened tissue. The suture which is placed in the vagina to repair the tissue, weakened tissue. Okay. Whereas colpopexy means fixing the vaginal apex into the position. That is also done along with the sutures in the correct position. Okay. What is hysterectomy? That is important. Hysterectomy means removal of uterus. And for reporting hysterectomy procedures, we need to always check for the weight of the uterus. It will be mentioned in the question, the weight of the uterus. According to that, the codes will vary. Now, what is ectopic pregnancy? Another important term. Ectopic pregnancy means pregnancy that occurs in the fallopian tube, one of the fallopian tubes. That means implantation that occurs in the fallopian tube and not in the uterus. Okay. Now, for reporting services for an uncomplicated maternity cases, always include antepartum care. Antepartum means before delivery. Then delivery and postpartum care. Postpartum care means after delivery. So these three are called as routine obstetric care. So which are the three important things that are included in routine obstetric care, or what are routine obstetric care? Antepartum care, delivery, and postpartum care. So for reporting an uncomplicated, means a normal maternity cases, these three are always included in the routine obstetric care. So code only for the routine obstetric care. Okay. Now another important maternity codes. There are 4 global maternity codes. 4 global maternity codes. 59400, 59510, 59610 and 59618. These 4 terms are very, very important, because if you will get a question from any of these maternity codes, it will be a little confusing. You need to identify first what is exactly happening in the procedure. Okay, let's move on to the codes. 59400. When you should use the code 59400? It is routine obstetric care including antepartum, vaginal delivery and postpartum care. If it's a normal delivery, antepartum, normal delivery and postpartum care, then you should use the code 59400. How about 59510? Routine obstetric care including antepartum, cesarean delivery and postpartum. This is cesarean delivery. First two codes are easy to understand, right? So if it is normal delivery including antepartum and postpartum, 59400. If it is cesarean delivery including antepartum and postpartum care, it is 59510. Next two are important. 59610. It is a routine obstetric care including antepartum, vaginal delivery and postpartum care after the previous cesarean delivery. It means initially there was a, like the delivery just before this one was a cesarean delivery, and then now they have done vaginal delivery. So vaginal means normal delivery, antepartum, normal delivery, vaginal delivery and postpartum care after a previous cesarean delivery. So in that cases you need to code 59610. How about 59618? Routine obstetric care including antepartum, cesarean delivery and postpartum care following attempted vaginal delivery after previous cesarean delivery. This means the previous was a cesarean delivery and then currently they have attempted for a vaginal delivery, means a normal delivery, but it was not succeeded. It's failed. In that case, an emergency cesarean delivery will be conducted. So currently what procedure has been done at the end finally? Antepartum, cesarean delivery and postpartum. But they have attempted for vaginal delivery, which was not successful. That's why they have undergone a cesarean delivery. Okay. So in that case, you need to use the code 59618. So these are the 4 global maternity codes. Definitely you will get one question from these maternity codes. One code. Along with, it can be along with the ICD also. Okay. So that's all about some important guidelines from female genital system. And for the practice questions, I'll be conducting it in the next session. So maybe you will get the practice questions within 1 or 2 days. So stay tuned for more videos. So friends, that's all about a few guidelines from 50,000 series. We'll be doing the practice questions from this session in the upcoming episodes. So stay tuned for more videos if you like. And if you have any comments, please share it in the comment box. And please support me. Please subscribe to my channel if you are new to this channel. Thank you so much and take care. Bye.